This video will focus on vitamin A, an essential nutrient, and its importance for human health. Presented by Medicos Online.
Vitamin A deficiency is a significant nutritional concern in many developing countries. This essential nutrient is vital for the visual system, cell growth, epithelial integrity, red blood cell production, immunity, and reproduction. Vitamin A exists in three main forms: all-trans retinol, long-chain fatty acyl ester of retinol, which is the main storage form, and retinol, the active form in the retina. Retinoic acid is also physiologically active. Provitamin A, or carotene, can be converted to retinol in vivo. This diagram illustrates the conversion of carotenoids to retinol, which then converts to retinoic acid. Retinoic acid is critical for both embryonic development and the adult brain. Vitamin A comes from animal sources, like eggs, meat, and dairy products. Beta-carotene, a precursor to vitamin A, is found in intensely colored fruits and vegetables, and green leafy vegetables. Retinoids are absorbed when retinol esters are broken down to free retinol in the small intestine. About 90% of retinoids can be absorbed. Carotenoids are absorbed intact, but at a much lower rate. Approximately 80% of vitamin A is absorbed with fat into the lymphatic system and then the bloodstream. Absorption is better when taken with fat and is poor in cases of diarrhea, jaundice, and abdominal disorders. Unabsorbed vitamin A is excreted. Vitamin A is transported from intestinal cells to the liver via chylomicrons. From the liver, it's transported to target tissues as retinol bound to retinol-binding protein, which is linked to transthyretin. The liver can store large amounts of vitamin A as retinol palmitate. A well-nourished person usually has enough reserves to last for 6 to 9 months or more. Vitamin A is not readily excreted. Some is lost in urine. Impaired excretion due to kidney disease or aging can increase the risk of toxicity. The functions of vitamin A include vision, maintaining epithelial cell integrity against infections, supporting immune response, hematopoiesis, skeletal growth, fertility, and embryogenesis. Vitamin A is crucial for the growth and differentiation of cells. Retinoic acid is necessary for cellular differentiation, embryo development, and gene expression. It influences epithelial cells in the skin and external passages. Epithelial cells require vitamin A for proper differentiation and maintenance. Deficiency causes dysfunction, leading to keratinized and scaly skin, and suppressed mucus secretion, likely due to impaired retinoic acid signaling. Vitamin A maintains healthy cells in the mucous membranes. Without it, the normal structure and function of these cells are impaired. Vitamin A is important for immunity. Deficiency leads to decreased resistance to infections. Supplementation may reduce the severity of infections in deficient individuals. One of the most important functions of vitamin A is vision. Retinol is a structural component of rhodopsin, the light-sensitive pigment in the retina's rod and cone cells. Inadequate vitamin A impairs vision. This diagram illustrates the vision cycle, showing how the retina and rod cells process light information. The retinogeniculocortical pathway carries the signal to the brain. The visual cycle explains the regeneration of rhodopsin. In the light, rhodopsin absorbs a photon, converting 11-cis retinol to all-trans retinol, initiating a cascade that sends a signal to the brain, and finally regenerating rhodopsin in the dark. Vitamin A also plays roles in preventing cardiovascular disease through its antioxidant capabilities and is linked to cancer prevention, specifically lung, oral, and prostate cancers. Studies suggest whole foods are more protective than supplements. This table outlines the recommended dietary allowances, or RDAs, for vitamin A by age and condition. Note the differing requirements for males, females, pregnancy, and lactation. This table further details the recommended daily allowances for vitamin A across various age groups, reflecting the differing needs throughout the lifespan. Vitamin A measurements include retinol activity equivalents, or RAE, and international units, or IU1 microgram. RAE corresponds to 1 microgram of retinol, or varying amounts of beta-carotene and other carotenoids. A deficiency of vitamin A can lead to serious health issues. We will now look into the high-risk groups and consequences. High-risk groups for vitamin A deficiency include infants, children, pregnant and lactating women, the urban poor, older adults, and those with conditions like alcoholism, liver disease, or fat malabsorption. Vitamin A deficiency often develops in environments with ecological, social, and economic deprivation. It frequently coexists with severe infections, which deplete vitamin A stores through poor intake and increased metabolism. The health consequences of vitamin A deficiency include xerophthalmia, the leading preventable cause of blindness in children, night blindness, and anemia due to vitamin A's role in iron management and hematopoiesis. Xerophthalmia is classified based on severity, ranging from night blindness, or XN, to severe corneal damage like keratomalacia, or X3B, and residual scars, or XS. Night blindness is the inability to see in dim light, resulting from inadequate pigment in the retina. It is also referred to as tunnel vision and can affect pregnant women, especially during the last trimester. This image illustrates the visual limitations experienced with night blindness, contrasting normal vision with the tunnel-like effect of impaired sight in low light. Bateau's spots are foamy, whitish, cheese-like tissue spots that develop on the eyeball due to severe dryness. While visible, these spots typically do not affect eyesight in daylight. Conjunctival xerosis occurs when the conjunctiva becomes dry and non-wettable. Instead of appearing smooth and shiny, the conjunctiva looks muddy and wrinkled. Keratomalacia is a major cause of blindness. The cornea softens and may burst, leading to rapid vision loss if the eye collapses. Other symptoms of vitamin A deficiency, or VAD, include alterations to the skin and mucous membranes, hepatic dysfunction, headaches, drowsiness, and peeling skin around the mouth and elsewhere. Follicular hyperkeratosis is another manifestation of VAD, characterized by excessive keratin production in the hair follicles, as seen in these images. Vitamin A status and deficiency are assessed using two main indicators: clinically assessed eye signs, known as xerophthalmia, and biochemically determined retinol concentrations in plasma or serum. Serum retinol concentrations are used to assess vitamin A status. Values below 0.70 mmol/L indicate VAD, while values below 0.35 mmol/L signify severe VAD. Public health significance of xerophthalmia is assessed using clinical and biochemical criteria. Key indicators include night blindness, Bateau's spots, corneal damage, and low serum retinol levels. The universal vitamin A distribution schedule for children aged 1 to 6 years is 200,000 IU orally every 3 to 6 months. Infants aged 6 to 11 months receive 100,000 IU orally every 3 to 6 months. Lactating mothers receive 200,000 IU once postpartum. The recommended xerophthalmia treatment schedule involves giving 100,000 IU immediately, the next day, and 2 to 4 weeks later for children 6 to 12 months. Children over 1 year receive 200,000 IU at the same intervals. The upper intake level for vitamin A is 3,000 micrograms retinol. Hypervitaminosis A results from long-term use of supplements at 2 to 4 times the recommended dietary allowance. The fatal dose is 12 grams. Acute intoxication occurs with excessively large single doses greater than 300,000 IU. Symptoms include nausea, vomiting, drowsiness, or irritability. Serum vitamin A values are elevated. Acute vitamin A toxicity from a short-term megadose can cause gastrointestinal effects, headaches, blurred vision, and poor muscle coordination. Symptoms typically disappear when intake stops. Chronic intoxication results from ingesting over 50,000 IU per day for several weeks. Symptoms in infants include anorexia, pruritus, bone pain, and swelling. Manifestations are generally reversible upon discontinuing vitamin A. Chronic toxicity from long-term megadoses can lead to possible permanent damage. Symptoms include bone and muscle pain, loss of appetite, skin disorders, headache, dry skin, hair loss, increased liver size, and vomiting. Vitamin A is also teratogenic, meaning excess intake can cause physical defects in a developing fetus, leading to spontaneous abortion and birth defects. This can occur with as little as 3 times the RDA of preformed vitamin A.